Hypertension is nowadays we can see in all patients. Why this hypertension is more prevalent? What kind of symptoms a person can exhibit? Avoid alcohol, smoking, caffeine, tea.
Au Revoir. Step into the magic.
Namaste. I am Dr. Chitra, Medical Head and Chief Physician at Au Revoir Wellness Center, Palakkad, Kerala. Good morning. Today I am going to tell about a disease called as hypertension. This hypertension is nowadays we can see in all patients or all people irrespective of the age. Why this hypertension is more prevalent? Because of this is considered as a metabolic disorder. And what is hypertension? Hypertension is the increased blood flow through the blood vessels, normal than their flow. And there are two types of high blood pressure. First is primary and second is secondary. Primary high blood pressure is unknown hyper blood pressure. There is no reason for that. Maybe because of our lifestyle changes, this blood pressure can come. And second is the secondary high blood pressure. The reason for this because of some medications, some kind of surgeries, all these can produces the secondary hypertension. Then comes the clinical symptoms of hypertension. What kind of symptoms a person can exhibit? First is a headache. The person will show profuse headache. And second thing is the bleeding through the nose. That is also one of the symptoms. And third thing, vomiting. Fourth is tiredness, uncontrolled tiredness. Fifth is swellings in the legs. These are the symptoms of hypertension. And then comes the treatment aspects. Ayurveda say the primary treatment modality is nidhana parivarjanam, that is the removal of the causative factor. So what all is the reasons for the hypertension we have to first remove. There may be different reasons, maybe because of our lifestyle, our stress management, our food habits. All these has to be changed. Then only we will get a complete cure. Next, different types of purificatory therapies like virejana, vasti, all these kind of procedures can reduce the hypertension complications and reduce the hypertension in the body. Then there are few tips that can prevent hypertension. First is food. The dietist plays an important role. In that diet part, we have to take more amount of potassium mixed foods like for example banana, buttermilk and lentils. These kind of food particles containing more potassium that can inbuilt reduces the high blood pressure. And second thing, we have to sleep at proper time. We have to take very less stress. And the food particles, we have to avoid excess salt content. Or a person who is said to be in hypertension or borderline hypertension has to take less than 6 grams of salt in a day. Avoid alcohol, smoking, caffeine, tea. You can use green tea on a daily basis. And proper exercise for 13 to 40 minutes can prevent high blood pressure. There are some few tips in terms of food. You can use every day 1 glass of beetroot juice that can reduce your blood pressure. And second thing, use pink salt, that is not the normal salt, not iodized salt. As per Ayurveda, use Himalayan salt or pink salt every day instead of the normal salt can reduce the hypertension attack. And use every day 2 to 3 teaspoons of flax seeds soaked in water. That can also reduce your hypertension. Last and foremost, if you don't have any kind of symptoms also, if you first diagnosed with hypertension, you have to monitor your blood pressure every weekly once. So make sure your blood pressure is not going too high and stay healthy. Thank you.
Au Revoir. Step into the magic. Malampura, Palakkad.